Well, yes.
Sorry.
So we're connected. I think we're ready to begin.
Good morning.
Morning.
I'm Dave Anderson, and I serve as chair for the Kansas Behavioral Sciences Regulatory Board. Today is Monday, September 8th, 2025. I ask the members of the board to respond to a roll call to signify their presence at this open meeting that is being conducted in hybrid form. Some individuals remote by conference call or other electronic medium, and some individuals present at the board's office. Jill Flessing,
Present.
Linda Heitzman Powell,
Present.
Donna Honer Queel,
Present.
Mary Jones,
Present.
Jim Kilmartin,
Present.
Richard Nobles, Andrea Perdomo Morales,
Present.
Cynthia Shendell,
Present.
Laura Shaughnessy,
I'm present and I'm having video problems. I'm here and I might log in on my phone, but I am here.
and David Stevens.
Here.
I note the following staff members are also present: David Fye,
Here.
Leslie Allen,
Here.
Cindy DeArcle,
Here.
Tim Resner, serving as legal counsel for the board, is also present. Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Dave. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the board about its any concerns, but the Kansas Open Meeting Act, or COMA, does not require the board to provide public comment or answer questions from individuals requesting to provide public director prior to the meeting. No time has been reserved for public comment, as no individual requested time for public comment. Because we are conducting this public meeting in hybrid form, I state for the record the following information. Access to this meeting is being conducted in person and by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call or by viewing the board's YouTube channel. While the meeting is conducted in hybrid form, the requirements of the COMA are not suspended. As such, we will be conducting this meeting pursuant to the COMA. On August 20th, 2025, we sent notice of the board meeting to all individuals who had requested notice of such meeting. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to the Executive Director, David Fye, at david.fye@ks.gov, and the subject line request for the agenda, and the agenda will be sent to you. The notice contains information for the conference call and YouTube channel and allows members of the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may send an email to the board office at bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And we did check the conference call line before we got started. There's no one currently on the meeting, but if someone beeps over and announces themselves, I will let you know.
Thank you, Dave. The meeting is now called to order, and the board will begin its discussion of the first item on its agenda. Are there any additions to the proposed agenda?
None. I make a motion to approve the agenda.
Second.
All right, we have a motion and a second. Any further discussion? Hearing none, all in favor of the motion, please say aye.
Aye.
Opposed, same sign. Motion carries. Thank you. We've got no public comment, right?
Correct.
Next item is review and approval of the minutes from our previous board meeting on July 28th. Has everybody had an opportunity to review those? If so, any request for changes to the minutes?
My motion to approve.
Do we have a second?
Second.
Thank you. We have a motion and a second. All in favor of the motion, please say aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Go, Dave, to the executive director's report.
All right, Thank you, Dave. We'll start first with some updates on BSRB operations and just a couple comments about our outreach efforts. So first, our website has gone through some changes over the last year. We've communicated to you that we moved from our previous host, Sitefinity, to Granicus, and in doing that, we made a number of changes to make the website more user-friendly and more accessible to individuals with mobile devices, and also to streamline some of the main functionality of the website, so people could get to what they needed to a little bit easier. And since our last meeting on August 1st, there was an article from the Association of State and Provincial Psychology Boards, ASPPB, that was recognizing a number of regulatory board websites, praising them for certain user-friendly features, and BSRB's website was one of those that was listed. So I just wanted to pass along that we did receive some praise for the website, and it was recognized under a couple different categories, and so happy to kind of deliver that news to you. You know, that is something we're doing with intention, and at least compared to our peers, it sounds like the changes we've made have been recognized as something that other agencies should do for different states. So I think that's some positive news I want to share. Concerning the YouTube channel that we broadcast meetings from, just an update, we have now broadcast or uploaded 215 meetings, and they have been viewed 11,744 times. So the numbers continue to rise. It is something that we have a lot of conversations about with individuals from other states as a way to be proactive and make sure people know the work of the board and the advisory committees. And so we're going to continue to go forward with that, and then try to make any improvements in that process that we can. In terms of the next item, survey to licensees. So we've talked a little bit about the survey process this year. Last fall, we designed surveys with all the advisory committees for each of the professions regulated by the board, with the exception of social work. And then that social work survey was built this year with the assistance of that advisory committee. Now we have surveyed all of our licensees across those different professions. Social work does make up the largest number of licensees, and so we had about 2,000 social workers who completed a survey recently, and so our staff is working on summarizing a lot of that information. We'll continue to move forward. Our goal is to have an individual report for each profession, and then also a comparison report between the professions. So we will give you updates as we move forward, converting those draft reports to final reports, and then having that comparison report. In terms of other outreach, Leslie and I do presentations to students, and we have some of those coming up this fall. We offer those presentations to go over the licensing process, some of the expectations as a licensee in terms of being mindful of unprofessional conduct and other standards, and also to make sure people are familiar with the role of the board and some of the resources that we offer. And so one of our first for this fall is coming up next week. We'll be talking to some psychology students at Washburn campus here in Virginia. Moving next to the agency budget. So every state agency is required to submit a budget. And as a reminder for state agencies like the BSRB, we don't actually get any money from the state general fund or from the state for operations. We do operations based on money that we have in our fee fund that comes from licensing fees. Every year, though, we go in front of the legislature and we request a certain limit on how much we can spend in any one year. And we are known as a biennial budget agency, which means every other year we will have 2 budget years, whereas other state agencies will have 1 budget year. So you always have an approved year for your current year, and you can make adjustments or request adjustments to the current year. And then for us, every other year we have 2 budget years, and then the other years we have 1. So this year coming up in the spring of next year, we will be going in front of the legislature requesting adjustments to the approved FY 2026 budget, and then any adjustments to the FY 2027 budget. The budget is due to be submitted here in about a week. I've been working with the Office for Fiscal Management to look back on our past expenditures, try to see. I don't foresee any large expenditures that we will need to make in comparing what we were approved for to this year. In the budget process, there is one item that I anticipate, and that is, it's just a quirk of the budgetary process. Basically, the legislature put in a salary increase for state employees last year, almost across the board. However, because some state agencies only had 1 budget year, they only added the money for that salary increase for FY 2026. But for biennial agencies, since we have an approved 26 and an approved 27, that means on a technical scale, the money for that budget salary increase was not added for 2027. So what it looks like now is that the legislature put in a salary increase for 2026. And then according to the way it looks on paper, that money would go away. And so we'd be asking staff to take a fee or a budget decrease in 2027. That was not the intent of the legislature. The intent was for them to add it and have that be stable moving forward. But to make it stable, there will need to be an adjustment for the legislature to add that money in 2027 to agencies like us. For other agencies that only had one budget year, they will be able to just roll that into their approved base. So it will look like the biennial, they're getting a fee increase or not a fee increase, but a salary increase for employees. But really it's just to maintain what was put into the legislature in 2026. So the quirk, it happens regularly with the legislature, unfortunately. It just has to do with the nature of some agencies having 2 budget years versus 1. But I anticipate that being something that a lot of the smaller fee boards will be having as a technical adjustment to their budget. But like I said, all budgets are due to be submitted by September 15th. That should not be an issue. We'll make sure to go ahead and submit that, and then we can report in terms of where the money has been requested from one year to the next. I've been talking with the Department for Fiscal Management to get new numbers on our budget and in terms of how much is in the fee fund for the agency. And the last numbers they gave me was that it's about 1.8 million in the fee fund. Our budget per year is about 1.1 to 1.2 million. So it's basically somewhere between 1.5 to 2 years, but closer to about 1.5 in terms of how much we have in our budget right now.
How does that compare to previous years? Are
We
we
had-
still on a downward trend?
We are on a downward trend, and the board has approved some fee decreases. Those have not gone into effect yet. So those are going to be going into effect, and that should draw the budget down further. And then what we anticipate is when these multi-state compacts start to become active, like the professional counseling one, and then also the social work one, we're going to see a change in how we receive fees. So right now, if you're practicing in different states, you mostly need to get a license in those other states. For professional counseling, if you're a clinical professional counselor, once their compact goes into effect, you'll have an alternative option where you can get a privilege to practice in different states as an alternative to licensure. And a lot of those states are setting the privilege fee at a smaller amount, because one of the requirements is you need to have a license in your home state, and then the privilege would be something in addition to your home state license. So a lot of them are setting it at a smaller amount with the hope of increasing individuals being able to assist clients when they go on vacation or go off to college and things like that. So it should be beneficial in terms of mobility of practitioners and also mobility of clients. But we do expect that we will lose out-of-state license revenue when that happens, based on the switch. Now the hope is that if we see a lot more people getting a privilege, maybe that will potentially balance out. We just don't know what those numbers are going to look like probably for the next couple of years, as we see that transition where people's licenses are going to be expiring, and then people are making the choice between either renewing their license or doing a privilege instead. With the social work multi-state compact, once it goes into effect, and it's still about a year away from becoming active, you will have the ability to get a multi-state license in addition to your home state license. And with the multi-state license, you would be able to practice in all of their compact states with that multi-state license. So for people who are now licensed in, let's say, 5 states, they potentially could let that out-of-state licenses elapse once the multi-state compact goes into effect, and then get the multi-state license in their home state, and then be able to practice in all those states without having to purchase a license in those states. So it's really going to change how states are receiving license revenue. We're just going to have to keep an eye on that and see how much we lose from the out-of-state license revenue compared to people doing a multi-state license in Kansas. So, but we do expect that our fee fund balance will continue to decrease, and it had been as high as I think 2.1 or 2.2 million, somewhere in that range. So it's gone down from about 2.1 or 2.2 down to about 1.8. And with these other fee decreases that the board has approved, that should go down even further.
Thank you.
The legislature hasn't exactly said what they want that target to be. They've had some discussions, but I think, I think we can have that continue to go down as a benefit for our licensees until we get to about 1 year of expenditures. But I think if we start dropping down below that, that's where I would probably talk to the board. You may want to consider an adjustment. So we will look at that. But I will say, I've brought up this before, we try to plan for possible expenditures based on what we know. But we don't want to not have the money in the budget to spend. If we don't spend that money, it doesn't go anywhere. It stays in the BSRB fund. And so as much as possible, I look for ways to be efficient and save money. And so if we don't have to spend money, we don't. And so those kind of play into the equation. But looking next, I did want to give you an update on the transition to the new licensing system as well. Leslie and I have met with representatives from the Office of Information Technology Service. A number of our staff members have been doing a lot of work so they can capture our existing processes. That has taken quite some time, but that's because we have so many different types of licenses. And we also have, tiered licensure for most of our professions. We've created a lot of ways to help individuals as bridges with things like the temporary licenses, the provisional licenses. And so those things have been really helpful, but it does make us more complex than some of the other agencies that have one license and it's a lot more simple. So they're trying to capture everything that we've done. For the most part, I think they've captured everything. Now what they're doing is they're trying to redesign our process, because the next step will be take what we had before and look to see if there's ways that they can add efficiency by making it a better process. And what I mean by that is right now, for our renewals, you can renew electronically, and the vast majority of our licenses do. But for the initial applications, those are still paper applications. When people apply for licensure, they print it out, fill it out, and then send it to us in the mail or drop it off in person. One of the main benefits of moving to this system will be people applying for licensure from the beginning. But right now, based on how you believe you will qualify for licensure, you will fill out a form for original application, or you'll fill out the reciprocity application, or you'll fill out sort of a transition application or something like that. There's a lot of different types of things that we've designed to be helpful. And what we can do in this new system is there will be a series of questions. And based on your answer to those questions, it will point you in certain directions. And so I think there won't need to be so many different ways that people can apply for licensure. It's really more you're applying for licensure as a professional counselor. And then based on what you answer in terms of years of practice, are you licensed in other jurisdictions, that will route you towards possible qualification for a reciprocity license or a clinical license versus a non-clinical license. And then it will also route you towards the appropriate fee. So a lot of our staff time right now, as far as matching things up to people, it will hopefully sync up a lot more of those things, so it'll be more seamless. They're also asking us questions about some of our existing processes where we have people mail us things like references, or how we get things from the schools in terms of transcripts, and how we can make those things more efficient and get those all in a more uniform period of time. And so we're looking at that too. So it's going well. I think what they've told us is usually about a 2-year process from beginning to full implementation. We're about maybe a little over 6 months to process. So I think it's probably still about a 1.5 years or 1.25 years until we're fully launched. But that involves also some testing once we get pretty close. So I think we'll have a really good system when it moves its direction, and excited to see what happens next. But right now we're at the exciting time. We really wanted to move to this earlier. We actually even asked them if we could move to this at the beginning of the process and say, let's just design this from here. But based on their work with other agencies, they tried to do that. And then once they were working with the vendor, they realized there were a lot of steps that they had missed, and they had to go back and make corrections, and that made things more complicated. So we're trying to follow their process, and they've been great to work with. So we'll keep you updated on it. In terms of other items, there is an annual report that we fill out every year. This has to do with a bill that passed in 2021. It is House Bill 2066. And what it did is, it was not called a universal licensure bill, but in the years that have followed, it's been referred to a universal licensure bill. And every state that passes universal licensure does it in kind of a different way. What this bill did is it basically looked primarily at individuals who are licensed in another state or jurisdiction. And it basically said, if you are a military member or military spouse, if you are a Kansas resident or someone who is intending to reside in Kansas, there are certain timeframes that we will process your materials once we have a complete application. And it also said, we are going to be looking to license people more quickly based on if you have an existing reciprocity statute, we will move you through that process. If you don't qualify for that or your state doesn't have one, then we will also look to see, do you have a license from another state or jurisdiction with a similar scope of practice? And if you've had that license and been practicing for a year and you meet some other requirements, you'll be able to get a license. And so when it was initially put forward, it allowed us to license people more quickly because our existing statutes called for practicing 48 out of the past 54 months. But if you recall, there was some confusion because it didn't apply to everyone. And people who were in Missouri were thinking, I thought this would apply to me because I heard that the reciprocity things changed. Well, if you're not a military member, military spouse, if you don't live in Kansas or intend to reside in Kansas, you don't qualify for it. So what the board did in a really good bill in 2023, the BSRB board put forward some initiatives to help with workforce. And one of those was to reduce the years of practice for the reciprocity requirement in the regular statutes from 48 months down to 12 months to meet the same time frame as that military bill. So when this statute passed or the bill passed in 2021 and became part of the change to the statute, there's also a reporting requirement as far as how many people would fall under this category. And then what were the time frames in terms of how long between when they applied to when they had a complete application, and then how long from when they had a complete application to their license was issued. And then if anyone didn't meet the appropriate time frame, sort of the reasons why. So when we initially were reporting this information, there were a fair number of people that qualified under the statute. But with the board changing the regular reciprocity statute, based on the way the language is read, you go through the factors for your existing reciprocity statute first. And if someone doesn't qualify, then you look at the 26 factors. So we did provide the information as an update to this report. But I think if you're looking at our past reports and comparing our numbers this year, the numbers are going to look a lot smaller. It's not that fewer people are becoming licensed through reciprocity. It's really just that the action the board took to help people out means that we're actually licensing people under our existing statutes, not the universal licensure or reciprocity one, because it doesn't actually get to that point. So if you're kind of looking between years and you see a decrease in number, that's the reason. So just kind of wanted to explain that to you, and I put that in the comment that I provided back to legislative research. But in working through our staff, we are tracking how many people qualify for it, but it's a smaller number just because of what the board did to help other people out with the statutory changes. And then in terms of some other updates, in terms of operations, I am really excited. In about a week, I'll be attending the CLEAR conference with a number of members of our staff. This is a conference that has to do with licensing and regulatory matters. It's a great opportunity for our investigators to receive training. Leslie and I will be attending, as well as my assistant Emma. And so there are different paths at this conference. There are some that deal really with more of the work of investigations and discipline, some that deal more with licensing. And I really think it's important that our staff members receive training in these areas. That's something that I think is important. And also it's important for us to know what the best practices are in other states. We try to do the best job that we can with our conversations here and kind of learn from what people are talking about. And as much as possible, I try to bring things back from national associations, but meetings like this are a really good opportunity for our staff to also learn, what is going on in other states, what is being upheld as a standard that we should try to meet. And if there's things that we could be doing better, it's a good opportunity for us to take those and bring them back to. So I will be attending that with some of my staff members next week. And so we may be a little bit less available during those days, but we will report back on what we learned from the conference after that. And then Under operations, the two last comments before I move to some legislative updates. The board does hold an annual in-person out-of-town meeting, and that in-person meeting will be on Monday, September 29th. We've mentioned that a couple times, but this is a reminder that will be an all-day meeting starting at 9 a.m. The information as far as the location of that conference is posted on the BSRB website. It is open to the public, but we have gone through and done the announcements publicly about that meeting. But that'll be an opportunity for the board to work through different items that will take more discussion time and things like that. And I did want to highlight, there was a retirement of an individual. Her name previously was Allison Conklin. She is someone who has worked in state government for a number of years, I believe between 30 to 40 years. And once upon a time, she worked for the BSRB. She actually reported, our connection to her is that she has helped us out with HR issues for the Department of Administration. And so she has been one of my best help as an executive director to help me get up to speed and help me kind of figure out how to do things the right way. And so I wanted to recognize her, and kind of we went to her retirement ceremony, but since she was also a former BSRB employee, I thought that was a nice connection to kind of make you aware of, in case any of you were familiar with. Moving next to some legislative updates. There have been a number of interim committees I wanted to make you aware of. These meetings are on the legislative YouTube channel, so if you ever want to go back and watch some of these, you're welcome to do so. The information for these meetings is also posted on the legislature's website in terms of any handouts or testimony. So one of the first items, there was a 2025 special committee on health and human services. They met August 19th and 20th. It was chaired by Representative Will Carpenter. It focused on staffing for the new state hospital primarily. A lot of conversation was focused on contract nursing and some of the ways in which the state can approach the topic of staffing for that hospital primarily. There was also the 2025 House Select Committee on Government Oversight, and this committee met on July 29th, 2025. It is also meeting today as we're in this meeting. They primarily were focusing on the Board of Nursing and some of their operations as a board. They were specifically looking at some of their disciplinary processes. And at their last meeting, they had some individuals who were licensed and allowed their license to expire. And it was asserted that they continued to practice, and they had consent agreement orders connected to that practice. And so the legislature was asking them questions, and there were some questions about, is it unprofessional conduct for you to allow your license to expire? What is the main concern here? And I think there was also some questions about some of their other operations, such as when your license is about to expire, how is the board notifying people about that process? And so, they have some things set up differently than we do here, but we are watching and listening to the legislature. And if there's items of concern, we want to be responsive to those as well. I think I mentioned this at some of the advisory committees. One of the things they did talk about at that meeting, it sounds like they send a paper postcard if someone's license is going to expire, but they don't send email reminders unless they sign up for a special service for that. For us, we send an email reminder 90 days out, 60 days out, and 30 days out. And then if your license does expire, we send a message to the person to say your license is now expired. Please don't practice. If you would like to practice anymore, you will need to reinstate your license. So we do try to provide notices to people and then information about what it means when your license does expire. And one of the people who was at the microphone testifying during that meeting did praise the BSRB. They were licensed as a nurse, but also an addiction counselor. And they, while they were critical about the lack of reminders from the Board of Nursing, they did say that it was helpful to get the reminders from our office concerning their addiction counseling license. So I just kind of wanted to bring these to your attention. We are trying to listen to the legislative conversation. If there's things that are important to the legislature, of course, we want to be mindful of them. And if there's practices we can improve upon, we want to do that too. But if there's things that it sounds like we're doing right, we want to make sure that we continue to do those things as well. So we will go back after today and listen to the conversation for the meeting today. And if there's items we can provide updates to you, we'll do that in the future. There was also one other meeting that is happening tomorrow and the following day, and that is a Senate committee on efficiency. And I just saw the agenda for that meeting. There was one item in particular that I thought was kind of interesting. There is a topic for the meeting on September 10th. That there's a presentation on using artificial intelligence to detect opportunities for efficiencies in government. And that is by a company called Accenture. I don't know anything more about that presentation, but I'll definitely go back and listen to that. But that will be on Wednesday, September 10th at that Senate governmental efficiency meeting. A lot of the topic for that meeting on the 9th and the 10th appears to be on the state fire marshal. I don't have a lot of information about that. But there was also, I had mentioned legislative post audit was collecting information in the past, and we provided information to them on building space. And if there's agencies that have building space they're not using, the Department of Administration will be presenting information on some of the building space usage by state agencies at 9 a.m. on September 9th at the governmental efficiency meeting. And then there will be a comment on the presentation of the performance-based budgeting and metrics by the division of the budget. And then you may have heard legislature put in for state agencies that receive state general government or SGF funds, that there should be a 1.5% reduction for that. And there's going to be a report as far as the impacts to nonprofit or provider associations by that decrease of 1.5 in state general fund expenditures. That does not affect the BSRB because we don't receive any money from the state general fund. So I want to make you aware of that in case you are tracking that with other agencies.
I'm sorry, when was that?
That will be on Tuesday, September 9th. So that'll be tomorrow. And it's scheduled for 10 a.m. During that meeting, the governmental efficiency meeting.
Thank you.
And then just as I kind of wrap up my report, Mary Jones and I will be attending the annual meeting for the Marriage and Family Therapy Regulatory Board Association, and we will be presenting on the survey. So really excited to have a great presentation with Mary about that. That will be a week from today, and that will be in Chicago at their annual meeting. And then in your packet of material, you should also see an update from Jason Katz on his service with the Kansas Expedition Grant Review Board, and some comments from him as far as the most recent meetings and some of his work with that group. So with that, I think I'll go ahead and end my report and see if there's any questions from any members of the board about the topics I discussed or any other comments.
Thank you, Dave. Any questions from the board? Don't see any, Dave. So we'll move on to updates from National Association meetings and multi-state compact meetings.
Okay. And I'll go ahead and start this topic. If you don't mind, we'll just go a little out of order. I'll talk about the social work multi-state compact. We did have a special meeting. I'm the commissioner for Kansas for the social work multi-state compact, and we had spent some time developing rules for the compact. The compact does say that in order for individuals to be eligible to practice under the multi-state compact for a bachelor's, master's, or clinical, they will have needed to essentially pass a licensing examination. And there was a question of which ones would qualify for that. And so the proposed rule that had been out for comment was that for the bachelor's, the licensing examination recognized in the rules would be the Association of Social Work Boards licensing examination, ASWB, the bachelor's test for that. For the clinical level, that would be the ASWB clinical exam. And then for master's, there's two different licensing examinations used in different states. There's the master's level exam, which is used in the vast majority of states. There is also an exam called an advanced generalist exam. And so the proposed rule was that the advanced generalist exam would be sufficient as a master's level exam recognized by the compact. And then the master's level exam would also be sufficient as a master's level exam for the compact. There was a quirk in that because Ohio previously had used the advanced generalist in a handful of situations to allow individuals to practice the clinical level, but most states do not. And so this allowed for a year past the date that it was adopted. So it was adopted at the meeting that took place about a week ago. So it allows for a year for individuals to basically anyone who was okay within this time frame would be fine, but after the next year, any individuals would have to pass the clinical test to be able to qualify for the multi-state license at the clinical level. So that was something that was really important. There was also a decision by the commission in terms of proceeding with a data system. That is the big thing that does take time for these multi-state compacts. You have to have a data system and you need to choose a vendor and then choose what you want to be included in the data system. And then you need to have that built, tested, and then it would go live. So that process does take a long time. Up to this point, they had received some requests for proposals from a couple different companies. One of them was a company that had worked at other compacts, and I think it's called Inspiring Apps. And then the other company was Tyler Technology. And so both groups were asked some questions. Some of that was in a confidential session because of the nature of RFPs. But ultimately, when it came back to the full committee, it was a decision of the commission to start contract negotiations with Inspiring Apps. So that doesn't necessarily mean that there will be an agreement with Inspiring Apps. We'll still need to have the executive council work out an agreement that makes sense in terms of the amount of money that would be needed to put forward that system. But I think between the two vendors, there was at least an expression to go ahead and begin that process of contract negotiation. So that's a big step. And we'll keep you updated as we go forward. But now that they've selected a vendor, at least to enter contract negotiations with, they can start that process and then also decide what they want to include in that agreement. And that's probably going to go into the pricing for that agreement as well. So that is the big news from the social work multi-state compact. I will turn it over to Richard first to see if there's any updates on the SIPAC multi-state compact.
Good morning. So there haven't been any significant updates since our last meeting with respect to what has come down from SIPAC. I have been asked to serve on a committee to review the bylaws and the regulations of SIPAC, and I have agreed to serve on that committee. We have just formulated the committee. There are 5 of us, and we are setting a time to have our first meeting. We also had a discussion in the Licensed Psychology Advisory Committee about the proposed rule changes within SIPAC's governing documents. The rule change is a significant one. It changes the educational requirement for those who are applying for both the electronic or the telehealth privilege and the in-person to practice privilege. And we will discuss further in the advisory committee if there is a direction that the committee would like for me to go when it comes to voting on the proposed rule change. The meeting for SIPAC, its annual meeting, is going to be November 16th and 17th in Tucson, Arizona, and I will be in attendance of said meeting. And I believe that is the bulk of what has gone on over the course of the past couple of months with respect to SIPAC.
Thank you, Richard. And I'll turn it over to, if she is able to do so, Laura Shaughnessy. I know you were having some technical issues earlier, but if those have been resolved, do you have any updates on the professional counseling multi-state compact?
I'm here. Thanks for that. I just jumped on my phone. Well, the counseling compact, the good news is, we don't have any big updates. We have received information from Greg Searles, the executive director for the Compact Commission, that the go live date is very soon. He said that date is still private. So since this is a public meeting, I shouldn't say that date out loud, but it's very soon. And as soon as they have an official go live date, they will be making it public, and everybody in Kansas is going to know about it because we're very excited about it. That's all we have. David, do you have anything else you want to add?
There's an update later on where we talk about the background checks, but that will relate to this compact, but I'll just go ahead and save that till we get to that item on the agenda.
Great. Thank you for that. Thank you, everyone.
Anything else related to that? Okay,
No, thank you.
our next agenda item is staff report.
I don't have anything at this time.
Okay,
Yeah, just the only thing is your normal packet, your normal chart, which shows the trajectory of licenses over time. And that number, does continue to increase. There was an unusual drop in the number of addiction counseling licenses. Between July and September, that number did go down, for LACs from 529 to 498. And then for clinical level licensees, it went down from about 598 to 569. So I don't have a lot of details about why those numbers are decreasing, but I can tell you, looking at all the licenses in total, even with those decreases in the addiction counseling field, the number still went up by 100 licenses from July of 2025 to September of 2025. It went up from about 16,500 to about 16,600. So still a positive trajectory, even though there are some decreases in certain areas.
all right, thank you. Complaint Review Committee report.
Are you going, Cindy?
And Cindy,
You're
you're-
muted.
She's muted. You're muted, Cindy.
I was so ready. The CRC met for 3 hours on Monday, August 11th. Our next meeting is scheduled for Monday, October 20th. The updated documents are in your packet. I wanted to let you know that I look forward to attending the upcoming CLEAR conference. I've previously attended 2 specialized training. I'm certified. I've received certifications from them in specialized investigator training. And I hope to learn more about some new disciplinary and investigation and best practices from other states.
Anything you'd like to add?
No, we welcomed our newest member to the Complaint Review Committee. So Laura joined. We're glad to have her on that. And she took note that our advice about the being ready for some reading was helpful advice. I appreciate you joining that committee. And thanks again publicly to Jim for his time on that committee. And he was, I'm sure, very sad to step off that committee. But it opens up other opportunities for him, I'm sure.
Very good, thank you. That takes us to professions reports, licensed psychology.
Good morning again. Excuse me. Good morning again. The Licensed Psychology Advisory Committee met on Tuesday, the 12th of August, 2025, and we had a number of robust discussions. First, we heard public comment regarding the elimination of the postdoctoral requirement, and we further discussed the matter later on in the meeting. We'll continue to deliberate as to whether or not we would want to make any formal changes in regulations or statute regarding the postdoctoral requirement. We also had a continued review of the survey, and we focused on discussing practice-related issues. We'll continue to have a discussion about the survey sent out to psychologists. There has been an opening on the Licensed Psychology Advisory Committee, and we've asked members to review vitae so that we could select another member to serve on the committee. We had a brief overview of the regulations that we may want to revise over the course of the next year, and we'll further discuss that. I'd saved this for last. As a recapitulation of what I said earlier, we had a discussion about the rule change in SIPAC, and public comment is open on the rule change until October 3rd, 2025. I've encouraged members to review the proposed educational rule change on SIPAC, and we can have further discussion about it in our next meeting, which will be on Tuesday, Tuesday, the 14th of October, 2025 at 6 p.m.
Thank you, Richard. Social work?
Yes, the Social Work Advisory Committee met on August 12th, and we welcomed 2 new members to the committee. We also approved finally our revised social work supervision manual. And one of our members indicated that she was in the process of doing her clinical training now and would have really appreciated having the information that we've included in the new supervision manual. So I'm excited to have that available, both for the supervisor and the supervisee. So the supervisee has some idea of what they should be getting in their supervision. We also began a review of survey questions. There's a robust amount of information in the survey, so we're doing it in sections, and we will be considering and learning about the answers to the next set of questions at our next meeting, which is going to be on October 14th.
Thank you, Cynthia. Professional counseling.
Thank you. Hello again, everyone. The Counseling Advisory Committee met on August 4th. We welcomed 3 new members, and they immediately started to comment and ask good questions. So we think they're going to be very interactive members, which we're excited about. We reviewed the survey, spoke about confidentiality, use of AI. We decided also, because of the the intense content of the survey, we're so grateful that we have all that information. We're going to chunk it out and divide it in over the next advisory committee meeting so that we can really break it down. Next time we'll talk about telehealth on the survey. That's what we're going to tackle first. We discussed an alternative pathway to licensure, and we discussed annual board training that will come up for the new board members, our new advisory committee members, excuse me. Our next meeting will be October 2nd. Thank you.
Thank you, Laura. Master's level psychology met on August 6th. We too welcomed a new advisory committee member, continued our review and discussion of the survey results of licensees, and continued discussion on the regulation of artificial intelligence. We too had a discussion of alternative pathways for licensure, and we will meet next on October 1st. Marriage and family therapy.
Yes, thank you. The Marriage and Family Therapy Advisory Committee met on August 15th. We also reviewed and had further discussion on survey items, particularly around negative practice issues and then issues involving supervision. We'll continue those conversations at our next meeting as well. We did have more conversation on artificial intelligence. We also reviewed new advisory committee member candidates, and we made a recommendation to the chair on 2 new members to the advisory committee. We also had some discussion on alternative pathway to licensure, but we'll pick that up next meeting, which will be October 10th.
Thank you, Mary. Addiction counseling.
Good morning, everyone. The Addiction Counseling Advisory Committee has not met since the last board meeting, as the committee has elected to meet quarterly. We just happened to have our meeting set for Thursday of this week, which is the 11th of September at 1 o'clock in the afternoon. While the agenda has not formally been set, I anticipate that we will start a more in-depth review of the survey of addictions counselors, and continue conversation on AI and potential pathways for making up practicum hours and potential pathways to potential alternative pathways to licensure. Otherwise, I hope to have a more robust report at our next board meeting.
Jill. Behavior analysis.
Yeah, we met on Friday, August 14th, and just like several other committees, welcomed a new advisory committee member. We also reviewed and voted to extend an offer to an additional member. We covered the expectations of advisory committee members, and looked at, continued to review the draft survey that went out, and we're going to continue to do that, where we're going to examine 2 items or so each meeting so that we can look at it in detail. We were going to discuss alternative pathways for licensure. That is going to be a little bit problematic for the behavior analyst committee, given that the behavior analyst certification board is very prescriptive about who can be a behavior analyst or not, and what is required for license or for credentialing for that. Our next meeting will be on Friday, October 10th, where we're going to do annual training for the board and advisory committee members and review of some of the pertinent regulations, such as application for licensure, supervision, expiration and renewal, and then a renewal audit. Thank you.
Very good, thank you. All right, we're scheduled for a 10-minute break. It is 10:55. So let's plan to be back at 11:05. All right, welcome back all. We are now at old business and a continued discussion on possible changes to regulation.
Give me that, please. Okay, in your packet of material, you should see a packet. It is a document that is about 21 pages. And that is the spreadsheet that shows all of the unprofessional conduct regulation items for each of the 7 professions, along with a last column, which was some suggested language by BSRB staff looking across the language for the professions. We have gone through as board members, you have been working through these items, and just as a real quick summary, each of the advisory committees have the opportunity to review their unprofessional conduct regulations, make recommended changes to the board. Then they saw the recommended changes from the other professions, have the ability to make further changes. So now here as a board, we're working item by item, see if there should be some consistent language between professions, or if not, if some of these items should be different by profession. And my apologies, at the last meeting, we looked at item number 24, and there was a fair amount of good discussion. I had anticipated trying to put together some language to capture a lot of those comments and bring back to you, but I don't have that for you today. So I will have that for you at the out-of-town meeting. But you could begin your discussion with another new item, and that would be starting with item 25 on page 7. Item 25 on page 7, it's the very bottom of that page. For a lot of the professions, it is essentially item Y. For some of them that use numbering, it's item 29 or 28. But the language basically says directing or directly or indirectly offering or giving to a third party or soliciting, receiving or agreeing to receive from a third party any fee or other consideration for referring the client or in connection with performing professional services. And just as a reminder, what these regulations do is they say any of the following acts would be unprofessional conduct. So instead of saying this is the act that is unprofessional conduct, it just is going to be a series of different acts. And then currently right now, that first column is for the addiction counseling profession. And if you flip back to page 1, you can see what each of the columns relates to in terms of the existing language. If there were some recommended changes by the advisory committees, that'll be reflected in some edits in the language there too. But on this one, the vast majority of the language is fairly similar. There is not current language for the licensed psychology profession that matches this item. Some of the professions include some language specifically calling out what type of practitioner that is, such as the professional counseling version of the language. But the proposed language in the last column from BSRB staff was directly or indirectly offering or giving to a third party or soliciting, receiving or agreeing to receive from a third party any fee or other consideration for the referral of the client or patient or in connection with the performance of professional services. So I'll turn it over to you and see if you have any thoughts. If you think this item should have consistent language across the board per profession, if you have other recommendations on possible language, or if you believe that maybe there's a profession that could have some different language.
Very good.
I'm wondering if indirectly has been defined through the complaint process, or other forms of compensation besides a fee. Has that come up? In the complaint process?
So in terms of a more specific definition, this would be open to interpretation by the members of the board serving on the complaint review committee on a case-by-case basis. So there's no supplementary document that you would use in connection to this to define it. But maybe Cindy could weigh in if she's able to do so whether she recalls seeing very many complaints or violations that might involve this regulation.
I am thinking it's not one that we have a lot. But I think it would be giving it to a family member would be an example of indirectly, and we have had that.
You mean referring to a family member?
Or compensation, providing compensation to a family member.
And I should note here too, in the process of the board discussing these items, legal counsel for the board, Tim Resner, is here. And so Tim, if you wanted to add any comments too, feel free to share your thoughts as well.
Yeah, I think that's a good example. I mean, it would, probably a frustrating example would be it's anything but other than directly, right?
Yeah.
But yeah, I mean, a family member, a third party involvement, some kind of a non-traditional, movement of the referral fee is typically what you see. But I don't recall an instance, in my time representing the board and the CRC of an indirect situation. So I can't come up with anything, off the top of my head there, Cynthia.
It just seems like a broad word to use that a lot of that could, I just think that might be harder to apply in some situations, but it sounds like it's rarely been an issue that's come to that anybody's complained about.
Yeah, I mean, I think likely the concern would be, some sort of a, paper transaction or subterfuge that's put in place.
Yeah.
To cover the movement of the fee, is likely the, sort of the bucket you would look at there.
Is there any concern that someone doing their clinical training who may be receiving supervision and are being given referrals by their supervisor and perhaps working without pay, their pay being the supervision, could that possibly fall under this?
I think this is really in reference to kickbacks or incentive
Right.
payments that go back. I don't see that being an issue with the way this is written.
Because they should have a contract, right?
Right.
Right.
Supervision.
And the
That
disclosures
spells
there.
that out.
Right.
I personally like the recommended language, and I'm comfortable with that.
Well, I do have a question. So in consideration for or patient, what's or in connection? You need a space in there with the performance of professional services. So is that? I'm not really sure what that means.
And I think maybe that was phrased that way because some of the section said performing psychological services and some said professional counseling services. So it was meant to make it general between the professions instead of having it tied to each specific one.
I think it would cover anything that requires your license to do. So that would be testing or counseling or therapy or whatever.
So does that mean like I feel like I'm being obtuse. Like this is like if I refer to Cindy because I feel like she's got a really good handle on working with this population. And
if I paid you, if I gave you any kind of a
There's money
kickback.
transacting.
okay.
It would
But
be
it
like, we'll
wouldn't
send you
be-
people and I'll give you $50 for every person you send me.
Okay, so it's not, so that last part is not like Cindy refers to me for psych testing and I do the psych testing and bill the insurance company, that's performing professional services. And that's,
And I referred to you for that, but you didn't give me any compensation for it, so it's not
Okay.
unprofessional
It's for
conduct.
the referral of a client or patient. So this is really
Okay.
like you start paying somebody for referrals. Or
Okay.
they are paying you for the ones that you refer.
okay.
There's no solicitation clause, excuse me, for psychologists. I thought there was a no solicitation clause somewhere in unprofessional conduct for us.
Mhm.
And I'm in favor of adopting the language as suggested or adopting the language as written for the master's level psychologists.
Yeah, I think it's a good, summary of what most of the professions have in there already.
And what would you all think as far as adopting sort of the general language from the column on the far right?
I would support that.
Yeah, I would too.
Yeah,
I
that makes
support
it consistent.
Is there anybody would not support that? Looks like we're gonna go there.
Okay. Well, if you could turn to the next page, you could start taking a look at item number 26. Number 26, for some of the professions, it's item number Z. For some of them, it's either number 30 or 29 or other. But starting with the addiction counseling language, it says permitting any person to share in the fees for professional services other than a partner, an employee, an associate in a professional firm, or a consultant authorized to practice. In this case, it says addiction counseling or clinical addiction counseling. The other language for the other professions is similar. Most of the professions appear to reference the specific profession, such as addiction counseling, behavior analysis,
Mhm.
family therapy, counseling, social work. The general language that had been considered by BSRB staff was permitting any person to share fees for professional services other than a partner, an employee, an associate in a professional firm, or a consultant authorized to practice. And then I suppose you could say, would there be any objection, or is there a better language than say authorized to practice a professional service? Trying to think of something broad enough that would capture everything.
What about behavioral health provider?
So would you say behavioral health services there in the last bit? Or a consultant authorized to practice? Or would you replace the consultant language with the behavioral health provider?
Yeah, and how does the consultant thing work, that where you would share fees with a consultant? Is that like if you referred out for a second opinion or for testing?
I think that would be like um if you paid or if you shared the pot of income or fees with a consultant um after after receiving consultation is kind of how I'm kind of reading it. You can pay the consultant for the consultation, but you can't pay the consultant for the monies taken in from insurance or any monies taken from the patient.
Well, that's kind of a slippery slope because it all comes from the same pot.
Am I reading that correctly
It
then?
says other than, so I think it's saying you can share with a consultant who's licensed to practice. You can share with a partner, an employee, an associate in a professional firm, or a consultant authorized to practice whatever your profession is.
Right, because
Sure
even if
what
you take it
associate in a professional firm means either.
Okay. Then yeah, my reading of it.
because what I was
What-
thinking, Richard, is like if I'm in a purely clinical practice, all my revenue is going to be generated from clinical income. And so if I pay them out of my general operating budget, it still is money that has come from the insurance company. So
Unless you're doing
I
private
don't
pay.
think I don't think we want to exclude paying a consultant out of revenue generated.
Well, that's just a practice expense.
It's
I think
really-
this would have to do with an incorporated practice group where you would have these people in your group and you have a, income sharing arrangement. And all, the money all goes in one pot. Everybody gets a share based on what their role in the organization is. That's what I think that this refers to.
Yeah, I think that's spot on, Cynthia. One thing you could consider, if you need some sort of qualifying language from the consultant, and that would be, that they participate in the delivery of services, because otherwise they wouldn't necessarily be associated with the professional firm that has, one or more disciplines in it. And so if that's the intent here, that could be some qualifying or clarifying language that in order to share in the fees, the consultant has to participate in the delivery of the professional services.
But would consulting with the clinician as a fellow clinician, because it's saying the consultant has to be licensed in the same profession, would consult, so that would be basically a peer consult within the firm, within your organization. And does that constitute that person you consulted with participating in the delivery of service? Or would it have to be direct delivery? Like they would have a session with your client to give a second opinion about your diagnosis. Would it have to be that? Or could they receive a fee for consulting with you as a peer within your organization?
Mm-hmm. Yeah, I think if that's acceptable to the board, then that could be some clarifying language that's added to, a consultant sharing in the fees.
I think from my standpoint, we might be making this harder than this is, like this statement, because it is, you can share fees with people who are eligible to provide service or they're part of your organization or part of your group. It would be people outside of that where it's not permissible. So I'm sharing with my neighbor Bob the fee for this service. For me, the language cleans up just saying a consultant authorized to practice, period.
To practice what?
Well, if they're in your corporation, you're talking about other than, which are important words here, for a partner, an employee, an associate in a professional firm or a consultant authorized to practice. If you're trying to keep the language general.
Maybe another way to look at this is, what was this intended to stop? Why do we have this? I mean, that's maybe another way to look at it, is why was this a regulation? And that's what Mary was talking about, is just to try to think about is, why did the board institute this? And it was Bob. Is that, and that's just a way to look at it, is to look at it. And it goes with, I think it goes with the one before it, is they were
Yeah.
trying to look at that. And maybe that's just another way to look at it.
Yeah, I see it as an extension of the previous one as well.
Yeah.
That is basically, not allowing anybody to be paid for referrals, to keep that whole process pure in the best interest of the client, not because we want to get a kickback from somebody.
Or perhaps to spend the money on an expert to the fees that they have to if you're going to pay an expert witness, that they have to write a check to the expert witness, not share the fees, or to pay Bob or something, that just to think about it that way when you look at the language.
Have we had an issue come up?
No.
This doesn't come up.
No, it has not. Not saying that that's a reason, but no, it has not.
Okay.
I think there's a lot fewer people practicing in that kind of a incorporated group than in the past, anyway.
I agree with Mary. I think the language is written well, and if it's not coming up, we can assume that it won't come up much.
Yeah. I don't know if that's if that's safe to assume with the changing landscape, but
Well, that's a good point, but
an
yeah.
associated and professional or a consultant authorized to practice. Mary, were you suggesting just practice and a period after that word, or because that were practice the same? I mean, that seems broad. A consultant authorized to practice what? To
Well,
practice
it's just like the one
consultancy?
before, it's the professional practice, so. You know, you have, and Tim can weigh in on this, but we have an implied, in my mind, you're within the regulation of your particular discipline. To me, there's an implied inference back to that regulation, but if that is not, you don't think legally that holds up, Tim, then we would need to put that on everything we do here. I mean, it would take away the generalizing, so that's all I was suggesting. If we all liked this language, it would be that, just like the one before where we did professional practice. Was my thinking.
Tim, do you want to weigh in on that?
Yeah, I think that's a logical assumption. I mean, it may be, you know, if it's authorized to practice, period, you know, is the intent to limit it to that particular discipline, or would the intent be to, you know, apply it to any discipline licensed by the board? Because that's a scenario that, you know, I suppose could come up, where there's
Well,
a interdiscipline referral or relationship.
if you put a sentence after it, it could be interpreted as authorized to practice consultancy rather than to practice the licensed profession that you're sharing the fee from. And as far as I know, there isn't really a license for consultancy at this point. There's a lot of people that
It could say authorized.
have a consultancy practice, but they don't necessarily have any licensure or.
Cynthia, I like that language that you just said, authorized to practice. What did you say?
No, I said it could be interpreted if you put a period after the word practice, a consultant licensed to practice, and you don't specify to practice a licensed mental health profession, then that could be understood as a consultant licensed to practice consultancy.
Right.
So you can add that.
Which isn't really there isn't any such thing. As far as I
So
know,
what
in
if-
Kansas, do we have any licensed consultancy or any consultancy license?
What if it said a consultant authorized to practice by BSRB?
That would cover it.
Yeah, that would cover it.
Or should it say licensed to practice?
Yeah.
What do you think, Tim?
Yeah, I think that's reasonable, Dave. You may, yeah, think about the language as far as any of the, you know, interstate compacts that may be in effect, but that would be good clarifying language.
And that would cover any future professions that might come under. I don't know that that would ever happen now, but.
You all right with that?
I think so.
Everybody okay with that?
Mm-hmm.
All right, moving along.
Okay. Well, item number 27, for some professions, it's AA, for some it is 31 or 30, or other numbering. Just start off with the addiction counseling. It says soliciting or assuming professional responsibility for clients of another agency or colleague without attempting to coordinate the continued provision of client services by that agency or colleague. There was some recommended changes by the behavior analysis profession, and that was actively soliciting any client of another agency or colleague without attempting to coordinate the continued provision of client services by that agency or colleague, or assuming professional responsibility for any clients of another agency or colleague without attempting to coordinate services for continuity of care. There is some language for the psychologist, which says soliciting or agreeing to provide services to prospective clients or patients who are already receiving mental health services elsewhere without openly discussing issues of disruption of continuity of care with the prospective client or patient, or with other legally authorized persons who represent the client or patient, and when appropriate, consulting with the other service provider about the likely effect or change of providers on the client general welfare. And then for the other professions, their language appears to be fairly similar, and it really addresses the soliciting or assuming professional responsibility of the clients of another agency or colleague without attempting to coordinate the continued provision of client services by that agency or colleague. So the proposed language here for consideration in that last column was soliciting or assuming professional responsibility for clients of another agency or colleague without informing and attempting to coordinate continuity of client services with that agency or colleague. So open to other comments or suggestions for modified language, or if there's a thought that some of the professions could have different language.
Mhm.
I'm fine with that.
And I would be in favor of adopting the language as a replacement or an augmentation to what's already written for psychologists. The psychologist doesn't, that particular regulation, it doesn't seem to have the assumption of professional responsibility explicitly pointed out. And I think that that's important.
The behavior analyst language there really addresses, talks about addressing the impact of changing service providers with the client or patient, whereas this universal language has to do with coordinating with the other provider. So I don't know, that's kind of two separate issues. I think the proposed language, summarizes what's the basic information across all of the professions, except for that issue of actually just, and maybe that's addressed in another one of these unprofessional conduct statements, the idea of just of talking with the client about the impact of switching providers.
So, David, could this be something we take back to our next advisory board meeting and get concurrence on accepting the general language?
Actually, at this point, the advisory committees, you could bring that to the advisory committee if you wanted to.
You hear your grandma Linda talking to you?
At this point, it's really more of the advisory committees have made recommendations and moved it to the board. So you as board members are really kind of having the discussion now.
Okay.
And so you could always get some comments from members of the committee, but it's really kind of up to the board right now to kind of decide some of these topics.
I like the recommended language. I mean, it does say without informing and attempting to coordinate continuity of client services. I think that could speak to both sides of that. So I think it's good, simple language that covers everything.
And Mary, which one were you looking at?
I'm looking at your BSA, your recommendation.
Okay.
I think it's.
Do we have consensus about adopting that language?
Yeah, I'm fine with it.
I agree with it.
Anybody disagree? Just trying to read the board. All right. are we doing on time?
You know, I think with the other items on the agenda, we could probably go till about noon on this one and then move to the other ones.
Right.
So moving next to item 28, and that one starts with BB for some professions, and then for some of the others, it's item 32 or 31. It says making claims of professional superiority that one cannot substantiate.
How would you substantiate that? I want to know. How would you
Um,
substantiate your professional superiority?
Well, it looks like the language is fairly consistent across the professions. I honestly don't know. I suppose if you were recognized by an association, they gave you an award, perhaps.
That's
Um,
substantiating it. It's probably just saying, I am the #1 social worker in all of Kansas. Says who?
Number
It's
one
sad
and
that
what,
that has to
right?
even be in there.
Yeah, the language looks almost exactly the same across the board. I think I'm fine with the proposed general language.
As am I. Anyone else? Thumbs up. Andrea,
Yes, sorry.
anybody not in favor of us adopting that language? All right.
Okay. We're moving next to item 29. This is a CC item for some. It's a 33 or 32 for others, or other lettering. For addiction counseling, it starts off guaranteeing that satisfaction or cure will result from performing or providing any professional service. And it looks like this language is fairly consistent across. So the proposed language was guaranteeing that satisfaction or cure will result from performance of professional services.
Again, it's very similar across the board, so I think the proposed general languages would cover what all the professions have already.
So reason we went with, from the performance of professional versus from the provision of professional services. Is there a difference? One used
Mhm.
kind of both.
Performance and provision, yeah.
I can certainly.
Performing or providing on one of them, yeah.
Everybody okay with that?
Maybe it should, but would provision cover then, like if people were recommending use of an app, for example, where you're not actually performing the service, but you're providing it or providing access to it? Maybe provision's a broader word that would cover anything that you might be providing indirectly as part of your professional service.
We could add in addition to the performance or provision of professional services.
Yeah, one of the professions said performing or providing any professional service, so.
And I don't know, but whether the word provision is a little unusual, it might be good to say will result from performing or providing professional services.
I'd be good with that.
So it would say guaranteeing that satisfaction or cure will result from performing or providing professional services. Okay. Looks like there's consensus.
Yeah.
Okay. Okay, we'll move on to the next item, item number 30. Item 30, start with the addiction counseling language. Claiming or using any secret or special method of treatment or techniques that one refuses to disclose to the board. There's a few variations on the language here. For example, the psychology language is claiming or using any method or treatment or diagnostic technique that the licensed psychologist refuses to divulge to the board. There was a recommendation by the Professional Counseling Advisory Committee to change the language to claiming or using untested or experimental treatment or techniques that one refuses to disclose to the board rather than secret or special method.
I think that's clearer.
The interesting thing about this is the protection around a claim of an untested or experimental practice, or is it around disclosing to the board, or is it both? So it's sort of like there's this element of it's unprofessional conduct to use something that I say is some special treatment, but it sounds like that's not a problem as long as I say I'll tell the board that I use this special treatment. So I'm just asking a clarifying thing there. It just was a little, when I read it, I was a little bit like, I wonder what the intent is. So if I'm claiming to use an untested thing, I say I'm using this new method, it's completely untested, but I've told the board I'm doing it. Or by nature of, I mean, I don't understand necessarily where it would come into play, but probably getting a little dice, like too specific.
I'm curious, Cindy, if you ever seen a complaint about this type of thing?
No. Yeah, so Mary has a very good question, because maybe if we disclosed it to the board could talk about it and find out it's acceptable. But no, we have not had that ability to discuss it.
Because it sounds like, as I read it, that it's unprofessional if they do it and won't disclose to the board.
Mhm.
Somebody makes a complaint and I say, I'm not going to tell you what I did.
Mhm. Right.
That does seem unprofessional versus,
Because it's special. And it's my secret.
Or like it's
But-
proprietary, like it's your
Yeah, 'cause
own.
it's proprietary. It's my secret blend. But no. And so therefore I hold it. But no, so we have not had, and I've been here for a long time. And so we have not discussed that.
Mhm.
because
I
I
hold.
think they could do something that was
Experimental.
experimental or kind of not standardized protocol. And as long as they were willing to discuss that, once a complaint was made with the board had the opportunity to kind of review it and say, yeah, that seems appropriate, or
Yeah.
no, that seem at all.
I mean, experimental is kind of a different level than untested, I think.
Yeah.
Experimental implies that we have an established theory or idea about a treatment that may be helpful, and we're experimenting with it. It's being used, data is being collected, etc. But versus untested, could be a lot broader. It could be just, that anything that a practitioner might want to try. And I think that on its face could be considered unprofessional, something that just you pulled out of the air without
If you look
any.
at the licensed psychologists, their language essentially just says doing anything that you're not willing to divulge to the board.
Yeah, it's the broadest of them all, I think.
Mm-hmm.
But
And
I
like that one.
I think
like
there's
it.
something in there. I think there's a reason for these. I think that somewhere back there's a reason for this.
Yeah, I like it just because it doesn't throw in this untested or experimental. It essentially just says, if you're doing something you're not willing to share with the board, then that's unprofessional.
Right.
Period.
Right. I
You
would
know,
agree with that.
Well, I just want to say that as somebody that engages in clinical trials or experimental studies, that we often ask people to disseminate information to recruit participants or have community-based providers that are write letters of support, and they're willing to use this strategy and collect the data as a part of their practice should people sign up. right? There's a whole IRB informed consent process that goes along with that experimental treatment that I would be, it just made me a little hesitant to say using experimental treatment. And then the refusal to disclose to the board, if it is something that uses a double-blind placebo, I suppose disclosing the intervention protocol to the board, should it be called into question, would be something that then we would get the board to sign an NDA that they wouldn't disclose what was non-disclosure agreement, that they wouldn't disclose what was in that NIH funded study. I don't know. It just made me think about what the implications could be for clinical trials.
If you're doing a clinical trial, you have consent from your clients that they're participating in research or experimental work. And you would be able to say to the board upon a complaint, here's the informed consent of the client with the disclosure that they're participating in this. And then that's done. There's no unprofessional conduct.
Okay,
Because
well, it says, or treat techniques. It said, what it says is experimental treatment or techniques that one refuses to disclose to the board. So if the board is willing to accept the fact that we have an IRB consent from the client as a disclosure, then my concern is null and void. But if the board wants the experimental treatment or technique to be
Specified,
disclosed, yes.
I think those are good points, but going back to what Cindy thinks, it's my opinion that that would be the spirit of this one, is that you would have a clinician saying, I am doing this great special sauce and I cannot share it with anyone, because then, you know, others will be able to copy what I'm doing and I can't disclose to the board. So I think that's more of the intent and the way I read this one.
We do have people part of domestic violence about disclosing what they treat, and a part of federal disclosures. And just generally, what we tell people is answer to the best of their ability. And how they answer and who they disclose and what information. But
that wouldn't probably be their techniques of treatment. That would be their clients are that they would need to protect. That isn't what this addresses. This addresses, you know.
Yeah, but so we do have people saying that they are worried about what Linda was saying about referencing specifics about what they disclose, and people contact us all the time about worried about how they respond, but we guide people to the best of their ability what they can disclose. But we have not sent out a complaint with this allegation on it so far at this time. But perhaps.
So what you're saying is I'm borrowing trouble?
No, I'm just but perhaps that's not the reason not to change it. But I always support I always think that there should be a violation for not cooperating with the investigator.
And there is now.
I like the language under the licensed psychologist one. I think that's the one I'm looking at.
Claiming are the secret or special method?
No, the third one.
Oh, I'm sorry, I went to master's level.
Claiming or using any method of treatment or diagnostic technique that
the licensee.
And then you could change that to licensee refuses to divulge to the board. Because it gets rid of the experimental and it gets rid of the untested, and it adds the aspect of diagnostic techniques.
And it really keeps the focus on the issue of non-disclosure to the board, whether it's untested, experimental, or well-established. If you don't cooperate and tell the board what your technique you're using, that's a
Sure.
unprofessional conduct.
Is everybody all right with that?
Mhm.
All right.
Yeah.
Agree.
Okay.
Okay,
And how about if we substitute a licensed psychologist with one?
Just licensee. Or,
Well, if we said one, that would potentially avoid any issue if we had somebody who had a temporary out-of-state permit, who technically may not be a licensee, but would still be under the board's jurisdiction.
Mhm.
okay,
Okay. How about number 31? And it says, continuing to order tests, procedures, or treatments that using treatment facilities or services not warranted by the client's condition, best interests, or preferences. Similar language is a little bit some of the other professions. Notably, there was recommendation for the Professional Counseling Advisory Committee requesting, providing, or ordering assessments, procedures, or treatments, or using treatment facilities or services not warranted by the condition, best interest, or preferences of the client. And so there's not some suggested language here. I think there's some similarity definitely between the different items. But open to your comments on if you like one of these the best, or if there's a reason why maybe psychologists should be a little bit different to include the word testing, or if maybe the general language would be sufficient to include across the board.
I think the professional counseling changes were nice there.
I couldn't hear what you said. I'm sorry.
Oh, I just said I like the edits on the professional counseling.
Thank you.
Because I think then it would cover what the psychology testing part. And it's also initiating, not just continuing. So also
Right.
if I request and refer a bunch of things that aren't necessary, it covers that.
the question I had on that was around preferences.
Yeah.
Sometimes people are involuntarily placed somewhere by a behavioral health professional. That's not preference of,
Preferences of the client.
and it wouldn't, I wouldn't want that to be unprofessional conduct if somebody came back and said, not where I wanted to go,
I think,
there are limited options.
If you were looking at a complaint that came in on someone who's, let's say, on civil commitment orders, when you would look at best interest of the client or warranted by the condition, that would supersede someone saying it's not my preference. And I think about maybe some of the complaints we get, Cindy, now from people who are not independent at this point. And there's a lot of that where there's, not their preference certainly, but so, I mean, it's a good point. It's a great point.
Yeah.
Mhm. Well, and I think that those commitments are governed by a whole separate body of law. So, if you were working within the legal requirements for commitment, then I think that would get you past the issue of preference, wouldn't it?
Would we be able just to take out the preference part and just leave it with best interest?
I
That was
like
actually my thought.
Yeah.
Doesn't it refer to client-centered care outside of involuntary commitment of listening to our clients?
No, I think that's a good point, Jill. I just would wonder if we leave preference in there, sometimes depending on if you're in a rural or how many beds are open for that client's
Mhm.
specific needs, sometimes their preference,
I know.
unfortunately.
And the client is free to act on their preferences if they're not civilly committed. So if you do act against their preference, but again, with an example like what Andrea gave, presumably you'd be explaining to them there isn't a bed available at your preferred
available
facility or
resources.
whatever, then they would be able to decide whether to take your recommendation or not. Assuming they're capable of doing that.
Right, because that would be, um, there's just that line where when you're working with folks that maybe don't have the ability to be
Mm.
able to make some of these decisions for
Right.
themselves, which is that whole field of people that behavior analysts usually work in.
And
Well, even if we add, excuse me, I'm sorry. I was just gonna say, if we added preferences of clients, like, I'm just thinking of other scenarios, in which case, like, maybe I'm working with a client who has a diagnostic condition that I'm not well suited to treat, but their preference is to work with me. But I'm needing to refer them. I think we could get real into some weird territory there
Mhm.
by keeping the preferences. So I think leaving it to Dave's point of, again, we're thinking about unprofessional conduct in a limited way, but if it just said services not warranted by the condition or best interests of the client, that
Yes.
seems to be clear.
Yeah, best
Yeah.
interest might represent their
Their preferences.
preferences.
Like the third column. Sorry, I don't have
Mm-hmm.
is it license?
Yeah.
Psychologists.
Yeah.
Wait,
Think
wait,
if you-
so I'm sorry, so we're not doing requesting? We're doing.
No, I like requesting, providing, ordering assessments, procedures, or that part that the professional counselors added at the beginning. I think those are good. That's good verbiage, because the other ones are just continuing things.
Or ordering. Mhm.
Mm-hmm.
So are you thinking that professional counselors and just getting rid of the or preferences in that last line?
Yeah, I think that would be clean.
But they eliminated continuing. And I think that's
Oh.
I think
But
we probably want
providing-
that in.
Wouldn't providing cover that?
I think providing would cover that.
Well, I think the issue of continuing is that people being recommended to stay on a medication, being recommended to continue a particular treatment beyond when it's necessary or
You're right,
when it's
you're right.
reached its usefulness. So that I could see, I don't know if there've been many complaints
Yeah,
like that. There have been, so.
I would just say that continuing is the issue, is that you continue to do this, that and maybe there's a better word, that you continue to do this after you know that we should not do this, that continue is an important word. In the present context, how we're using it right now, that you should know how we're currently using this regulation.
So if you were going to leave that in, then you would just start that sentence, continuing, comma, requesting, comma, providing or ordering, and the rest of it, tests, assessments, procedures, but remove preferences at the end.
Requesting and ordering.
Maybe that's redundant, huh?
Well, most professionals cannot order. And I mean, I just from a language standpoint, unless you're a physician, there's not a lot of orders we can write.
So getting
In
rid of
general.
ordering and leaving requesting.
Well, psychologists can order psych testing.
Yes, you can. If I'm just saying, that's gonna limit it but it does, I mean, you're right. It's not as common, but I'm just trying to eliminate some of the wording, but.
Right, because it's kind of cumbersome, yeah.
But yeah, I'd be okay with providing, because when you order something, I mean, there's an implied assumption that the service will be subsequently provided. I'd be fine with that.
Or if you think it's important to keep, we'll just have a lot of words in there.
I think
Names.
I think that eliminating ordering could be fine. I'd be fine with that.
Okay.
Okay.
Thank
And
you.
Jill, just coming back to Jill's comment about, because a lot of people that are a little bit outside the mainstream those person-centered support plans and taking client consideration is really, really important, because historically people have come in and just done to that population what they think is the best without taking the client's consideration and what their goals are into consideration when formulating the treatment plan and the support plan. So I think I like what we've come and agreed upon. It's just, I think that we'll have to recognize that once again, some of this is going to be a little bit outside of the scope, because it'll fall back up to just talking about it in terms of the client's best interest. And so if the client's best interest is to take their goals into consideration and we don't, then that would be unprofessional of us. Are you good with that, Jill?
Of it falling under that, someone could make a complaint and say, my preferences weren't considered, so therefore it wasn't in my best interest. And I think certainly the social work code of ethics, and I'm sure every other one includes, nothing about me without me. I mean, you are always working to within your services to consider what the client wants as well, even if it's in conflict with what your perception is of what they need.
Okay. Well, it sounds like there's a consensus of continuing, requesting, or providing assessments, procedures, or treatments, or using treatment facilities or services not warranted by the condition or best interests of the client. So the professional counseling with some modified language there.
Mm-hmm.
Yes.
Yeah,
I'm good with that.
All right.
Well, we probably need to stop today to make sure we can cover the other items in the agenda, but thank you for all of your work on that. And we'll pick it up at item 32 the next time that we go through this.
Yeah, thank you. I think we're making really good progress here. And I really appreciate the robust conversations, because it's important that we do kind of think about the nuanced aspect of these. That takes us on our agenda to continued review and discussion of draft survey reports of licensees, and a focus on marriage and family therapy and professional counseling.
Yeah, and I don't have a handout for this, but I thought as we the discussion moves from each of the individual reports separately, we might start to have a discussion about comparing some other professions and some of the responses on the survey. In some areas, there were some similarities, and in some there were some differences. So I had some staff members go through and take a look at some of the responses for professional counseling and marriage and family therapy. I just kind of wanted to continue the conversation today and note some interesting things. There was a question that talked about practicing in urban areas or rural areas or other. And while the majority of our practitioners sort of across the board did tend to practice mostly in urban areas, when you look at marriage and family therapy, the LMFTs, about 69% practiced in an urban area, and the clinical level was even higher at 73.8. So there does seem to be sort of an increase on the clinical level, more, at least proportionally, a higher percentage of clinical practitioners are practicing in an urban area versus rural area. And that is true also with the professional counselors. Professional counselors, the LTCs, 65% were practicing in an urban area, and 72% of the clinical professional counselors were practicing in an urban area. So I thought that was kind of interesting for both professions. You do get a little bit higher percentage of the clinical practitioners practicing in urban areas versus rural, although it is true for both that the majority of all professionals are practicing in urban areas. In terms of the looking at marriage and family therapy, working in private practice, so 75% of the LMFTs and 79% of the LCMFTs do work in private practice. So the vast majority of the marriage and family therapists do work in private practice. However, when you compare that to the professional counselors, the numbers were lower. So LPCs, only about 49% work in private practice. But for the clinical level, it is more similar to the marriage and family therapists. So about 69% of clinical professional counselors work in private practice. But when you get to the LPCs, it's only about 50%. When you work in public practice, there's a much higher number of professional counselors that are working in public practice, 29% for LPCs, only 16% for LCPCs. And then for marriage and family therapy, only about 6% of the LMFTs are working in public practice. And for the clinical level, only about 13%. So you are seeing a lot more of the professional counselors working in public practice, 29% compared to the equivalent level license, the LMFTs. I thought that was notable. There was a question on the survey that talked about, how many years have you been practicing in your profession? And one of the most common answers was between 2 to 5 years. For LMFTs, it was about 27%. And for the LPCs, very similar number, 32%. So that 2 to 5 year range, and that does sort of make sense because those are the individuals that potentially could be continuing to accrue hours towards a clinical level license. And it was notable that both the LCMFTs and the LCPCs reported they've been practicing for over 10 years, almost at identical numbers. So the clinical marriage and family therapists and clinical professional counselors, it was 67%, 69%. So those numbers do tend to line up. So I thought it was kind of interesting. On some of these numbers, we're seeing very similar results. And the reason why I wanted to compare these two groups is because marriage and family therapists have the tiered licensure at 2 levels. And in a lot of states, that's not true. But for us, we can kind of get more information for both levels and find some of this to be really interesting when the numbers line up almost exactly. And then other times the numbers are pretty far apart. So we are looking at individuals licensed in only one state. When you're looking at the LMFTs and the LPCs, those numbers were very similar. So a majority of the marriage and family therapists and the professional counselors were only licensed in one state. However, the vast majority of clinical marriage and family therapists were licensed in one state, whereas for professional counselors that were clinical, only about 46% were licensed in one state. So for clinical professional counselors, there is a higher number that are licensed in multiple states. So I do think, right now we're moving towards the professional counselor compact becoming active. And I think while we don't have the numbers from other states, we only have the numbers for our own state. If this holds out across the board, I think, at least the way it looks right now, we could see some individuals drop their licenses if that's true, and individuals in other states are holding multiple licenses. But it also is kind of interesting to me, if there was a compact for marriage and family therapy, at least the licensees in Kansas, the clinical level are mostly licensed in one state. So I don't know that we would see the same level of drop off with licenses. Hard to predict kind of people would want a privilege because, or what the model would be for a marriage and family therapy compact, but we're still kind of a few years away from that if one of those is going to emerge.
I just wanted to say out loud how grateful I am that you did these surveys at this time, because this is just basically going to be a baseline for us to see what happens in comparison with the compact. So I'm so glad we have this data now.
Thanks, Laura. And I realize it's kind of hard to kind of think about these numbers abstractly without, kind of seeing them on paper. But yeah, this is going to be helpful, having this before information. And I said, once the counseling compact goes live, we probably won't see the results for about 2 years because of how our licenses are staggered, and it's 2 years after you get your initial license. And for most of the other states, most of them have 2-year licenses. Some other states have 1 year. Very rarely will a state have a 3-year license. So I think we'll kind of be seeing the same things as we notice the change in our licenses. We'll be noticing what other states are doing too. So but anyway, I just wanted to share some of that information, just kind of some preliminary information. With the comparative report, we will try to do that, but we'll try to give you some nice graphs. So you will see the percentages. I think one thing that we're not going to be able maybe to represent the same way is the number of persons, because for some of the professions, we have a lot more people holding a certain level of license, but at least we can represent the percentages on the same graph and show you, approximately what the percentages are going to be. So we would like to kind of show this to you, but just doing an initial look at some of the comparison information, it is kind of interesting. And we'll try to add some of the other professions that have the two-tier licensure, like the master's level psychology. And then for the ones that have multiple, like the social work, we'll try to line those up too. So.
All right, thank you, Dave. Next, we have an update on background checks for licensure.
Yeah, so I've been working with KBI to kind of find out what our next steps are going to be. Still working on whether we need a regulation to be implemented to require the background checks. From my initial understanding, we may be able to go ahead and make this a requirement without a regulation, but I want to make sure that we're doing things the official way. In the meanwhile, I've done some research in terms of what information we will need to put out there to the members of the public. And I do want to compliment members of my staff too. I know that Cindy in our investigative unit, she's been helpful with this, and other staff members have been looking for the agencies that already require background checks. They do have some good information. So I don't have this in your packet of material, but I was able to pull some information that the Board of Nursing has in terms of what they require for fingerprints. They have a pretty good document that informs members of the professions how much the cost of the background check is, basically where they can go to have that completed. There's also a waiver that they fill out to do the background checks, and it talks about what they will need to submit to the board and at what time. The waiver does talk about the KBI processing and what information is needed at the time that they go and do their fingerprint card. So I thought we will probably borrow a lot of the same information that we post on our website. There was also some information here that talked about the FBI privacy statement that I think we can carry over and use some of that as well. There is also a right to obtain and challenge accuracy of criminal records. So I think when we do collect some of this information, when we do find items, we will be investigating those, and there will be a way that licensees and applicants can go ahead and become aware of that information as well, and then also provide supplemental information so that we can address that as part of the application process. So I think what they have is really good, and they also have some other information that they can provide to the board if they know that they have been convicted of a crime. To that way they can make the board aware of those things at the beginning of the process. And so I thought it was really good documents. So we have a copy of these on hand now. We can start to borrow some of this language, and I will send this to Tim as well, so he can take a look at this as we make preparations for us having similar documents and move forward on this. My goal is that we can figure out exactly what is all necessary. Now that the board at the last meeting expressed a desire to go ahead and require the background checks, I want to make sure that we have these things lined up. So maybe we can borrow from the Board of Nursing processes. If you do want to see a copy of this, please let me know. I'm happy to send it to you. It's also posted on their website under their fingerprint section. So we'll just keep moving forward on that.
Very good. Any questions? All right, seeing none, we'll move to new business. Appointment of new advisory committee members. I'll make the following appointments to the Behavior Analysis Advisory Committee: Holly Kramer. The Marriage and Family Therapy Advisory Committee: Stacy Hodges and Renisha Hunter. Next, we go to Plan for Future Regulation Review by Advisory Committee.
Yes, and so there was a bill that was passed by the legislature. I believe now it's been 3 years. And when that bill was passed, there were a number of bills that were floated around, but the version that passed had a list of all the state agencies, and that initial bill had some prior state agencies too. They did some cleanup on that in recent years, but It basically required all state agencies to be in a rotation. And every 5 years, a group of state agencies would need to submit information for all of their regulations and answer certain questions about those regulations. One of the questions is, does this link to an existing statute? And then, is this necessary for implementation of state law? If it's not necessary for implementation of state law, is it helpful? And how is it helpful? And what would be the consequences if this regulation was revoked? And so I have been in contact with the Department of Administration and the individual who reviews regulations, just to make sure we're prepared for that process. To let you know where we're at, we are on the group that would come up in 2026. So it's calendar year 2026. And that seemed like a long ways away a few years back. But in preparation for this, we have done a lot of work with all the advisory committees. We've brought a number of our larger regulations to the advisory committees and ultimately then to the board to make recommended changes. And some of those dealt with unprofessional conduct, the continuing education discussions that we had with the advisory committees, documentation of continuing education, educational requirements for licensure. And the board is really active with a lot of the work that we dealt with that had to do with programs being able to meet the requirements if they were online programs. And so the board has made a lot of recommended changes and a lot of reviews of different things. The reason I wanted to list this on the agenda, just to make you all aware of it and provide an opportunity for any kind of questions, is that as we prepare for that 5-year process, there's a number of regulations that are shorter, that are really more helper regulations that pair with the statutes, but kind of spell out things a little bit more clear. And some of those deal with applying for licensure or renewing your license, or potentially, reinstating the license. One of them has to do with what we look for if someone is providing services into the state by telehealth. And it talks about, we look to location of the client and services being provided. There's also a regulation that references the DSM-5. And so some of those, they may not need any edits, but some may need really small edits. And so I've been working with staff to identify a lot of those regulations that we haven't had the advisory committees review in the last few years, so that we can have the advisory committees review those this fall, starting with the October meetings. And if we have recommended changes, we'll bring those to the advisory committees. We don't think this process will take a long time. It's really more of, at the time that we fill out a lot of that information for our regulations, I would like to be able to say that over the last few years, we have brought every regulation to the advisory committees to at least review, to look at. And the advisory committees have made recommended changes, or they have told us that they don't recommend any changes. And the board has similarly had a chance to review that information too. So we've already done a lot of work, and you as board members and your advisory committees have done a lot of work on this topic too. You've reviewed, I would say, easily half of our regulations. These ones are much shorter, and I think they can go quicker. But it would be nice to go ahead and complete that process. And it sounds like in January, that's when members of my staff would be asked to start to fill out all that information. And ultimately, I think it's going to be reviewed by the Joint Committee on Administrative Rules and Regulations, JCAR. And we won't be the only agency. Like I said, all agencies are on a 5-year rotation, but I think we'll be up with some other agencies, and we want to make sure that at the time that we are asked to start that process, we can say, here's what we've done in preparation for this. We feel like our regulations are at a good spot, or we could say, these ones have been reviewed, these ones have no changes, these ones have had changes, or these ones are in the process of being modified. So I think at the last advisory committee, we brought a number of these regulations put on the radar of the committee members and just kind of provided these in your packet. And then at the October meeting, we will bring some recommended changes, or a sort of a statement that staff has reviewed this. We don't have any recommended changes, but if advisory committees do, we can kind of discuss them. So any questions on that process?
Doesn't look like it.
And this is not something that we've been necessarily directed by agencies to do. I just feel like I'm trying to be proactive and think about what they might ask us and expect from us. And if we can be proactive on this, I think will look pretty good. And honestly, we were supposed to be good stewards of these regulations anyway. We talked about the unprofessional conduct ones. Some of these had not been reviewed in several years. So we're doing what we need to be doing. But I think we'll have better regulations for everybody in the process too.
Yeah, Dave, I agree. It's been, I think, a really good process reviewing them, and I think we have. In doing so, look at some of them and went, wow, this really does, language needs to be updated or things need to be changed, so. Well done. Next, we move on to a discussion on possible agreement with EBAS for disciplinary remedies.
Yeah, and if you remember back, I believe it was 2 meetings ago now, there was a representative from the company, and I believe he may refer to the company as EBOS. But there was an individual who presented information to the board, and he talked about his company offers some remedies to disciplinary boards or disciplinary subsections of boards. What their company does is that if someone has had a complaint and the board determines there's a violation, one of the remedies could be to work with his company and have that person go through a process of taking exams on a certain topic, or maybe doing professional essays or writing very focused on a certain thing that the person needs to put emphasis on, such as confidentiality or a topic like that. And then that would be reviewed and scored by professionals that work with their company. And these would be things that would be agreed upon as part of a likely consent agreement order or something like that. The cost of those services would be the responsibility of the licensee who had agreed to those terms. So there would be no cost to the board. So there really does not need to be a financial factor. You may be wondering, if the board wanted to contract with that company, would there need to be an RFP or something like that? Because there's no cost to the board, there really doesn't need to be a competitively bid process for this. But I did want to bring it back to the board to get the board's comments if this is something that you would like the CRC to be able to utilize, or if you have other thoughts. But since there was a presentation, I wanted to bring it back and have the board the opportunity for discussion on this.
Would
I know
this,
from- Go ahead.
I was just going to ask, would this be just an option for CRC to use? Would it be something we would mandate that they work with? And what would the cost to the licensee be compared to what we're using now in terms of you've got to have supervision and you've got to have therapy for yourself and you have to pay for both of those? Would this be roughly the same cost to the licensee or more?
Yeah, it's definitely something that is open for options for the board to discuss, or for the CRC. One way that I was sort of envisioning this is if there was interest from the board, it could be essentially another tool or another option for the CRC to utilize if they have a situation where they think this might be a good item to propose as a disciplinary remedy. So it wouldn't be something that the CRC was required to use with any kind of frequency, but I did want to have the board discuss this topic. This is the first time that something like this has come up since I've been here. So with an outside company, I definitely want the board, for the board to have agreement that this would be a company they would want to use if they wanted to use this company. I can't recall exactly the cost for some of those services, but it sounded like maybe a few $100s for some of the tests, or for some of the examinations. And those would be by the licensee who agreed to that as a remedy. But that's from what I remember. And Cindy, if you have items on this that you remember, or Mary, I'm kind of curious for your thoughts too. So.
Yeah, I was gonna say, I think, Cindy, you're muted. Did you want to talk first? Go ahead.
No, I wasn't.
Oh, I was looking for your picture on the screen, Mary.
Yeah, I think in CRC, I think it's a really great opportunity to have another option at our fingertips. There are some cases where I know we all just kind of wish there was one more thing that would be really helpful for this licensee in the remediation process. So I think it makes sense to move forward with looking at what an MOU or a contract would look like with this group. I do remember some discussion and can't remember the outcome about, did we vet any other boards that were using this company, and do we have some references, if you will, around outcomes or how they were to work with, how the licensees performed or were satisfied with that. But in general, I think it's a good opportunity for us to have another item that we can use.
One of the things that he said was about how many tests that they usually have. Is that they're state specific, and that, you know, how many tests, like he'll develop them, and that some only do 2, but most do 3 to 5. And so that was one of the specific questions. So like if we just wanted to do 2, but you know, like we did, like confidentiality and dual relationships, but that was like one of the questions that was asked that stuck in my head, you know, so that if we wanted to do 4 specific tests, that's what we could do, and we would pick the topics. But most common was states did like, you know, 4 tests. That was one of the most, but some do many more. And then he talked really about how, not saying it, that people said that was the single most effective thing that they learned from. I'm not doubting that that is not true, but that this was, they learned more from this than from their supervision. He even said that this was a very good learning experience for them.
You know, I have a quick question. Did we ask the question as to whether or not we would receive the licensee's written answers, or would we just receive the score report, like the pass fail?
We did not ask that.
Because it could be the case that they say they fail per their metrics, but if members of the CRC read the answers and found them sufficient, that might be something to take into consideration.
I was thinking how badly they failed. You know,
Oh, well, that too.
if we'd readjust like what the, if there was another remedy, you know, besides taking the test again. But I was just thinking, to summarize what Mary said, that it was just another tool for our toolbox. And we've developed some new tools lately that have been effective, but you know, sometimes short-term remedies have been very effective for people.
Yeah, I've been involved on another board that did something like this, and it gave us the option, but in this case, the CRC really needs to understand the content of what they're assigning and whether or not it meets the goals. Once that's done, Richard, we just accepted the score. I think people got more out of it than just going to an in-service training, because they had to answer a test at the end. They were they actually had to pay attention.
Right.
They had to listen. They had to test out. And I'm one of those people that I have to write it down to learn it, and testing it is my best way to figure out if I have long-term memory. So I would support something like this as another tool for the CRC. I just think that the CRC needs to understand, if they're assigning section 1 or section 4, what is in those sections and how it meets. You know, I think the CRC is a smaller group than all of us to review all the content, but it's also because I'm not on the CRC anymore, and everybody watch Mary laugh. Uh, but anyway, I think it might be a very good opportunity.
I agree that it would be good to have in our toolbox. Would it be possible to have a representative come to the CRC meeting so that we can learn more and ask those questions like the one that Richard had?
That have to be an open board meeting.
I don't know, but that might be a question for Tim. It seems to be that, the practice of the CRC, at least in recent years, has been that it is solely the members of the CRC, legal counsel, the investigators, and myself. But would that be a meeting that the CRC could invite a representative to come and talk a little bit more about some of those things at the meeting?
Yes, I don't see an issue with that. I mean, you have 5 members on the CRC, so you technically wouldn't have a quorum. So there wouldn't be an issue, from that perspective.
You mean a quorum of board members for like the full board?
Correct. That would trigger the coma requirement. Yes.
Right. Okay. And I think in the past, years ago, it sounds like the CRC did previously have some other attendees. And then that was a practice that was changed somewhere along the line. So, okay, well, that's got the note. So I'm curious, would the board like to make any decision on this, or would you like us to gather some more information first before you agree to? I just kind of wanted the board to have sort of a
Go forward,
to
like, yes,
go
go forward with this.
right,
Yeah.
yeah.
Yes.
If that is what you want to do.
I would put that out there that I'm in favor of moving this forward. And if I like the idea, Andrea, a lot of having them come to the CRC where we could really deep dive into some questions. But for your purpose today, I think you need to know that the board wants us to continue to go forward.
Yeah, just because it's an outside company, and since there doesn't need to be such a formal agreement, but I thought, since we're working with one entity, that would probably be a good idea for the board to weigh in on it.
I would agree in moving forward. I do like the idea of receiving a couple of different references
Mhm.
And I'd be
other
happy
than
to,
just the company saying that they're great and well received.
yeah, I'm happy to talk to the individual and get a little information in advance of the CRC meeting, and I can ask for that.
I guess I would also want just some assurances or intel about their security level in terms of confidentiality. This is very sensitive information that they would have access to and on our licensees.
Other board members? With those caveats, Dave, sounds like you have consensus to move forward.
Okay, well, thank you.
That takes us to a discussion on notifying clients when practitioner is under direction. Is it yours, Leslie?
Yeah, okay, sure. We had a person call the board who is under direction and asked if they had to notify their clients they were practicing under direction. We looked in the regulations and there is a definition of under direction, which does not include notifying the clients that they are practicing under direction. And it seemed to us that perhaps it should, because there's a reason when you're under supervision, you have to notify the clients, and it would seem appropriate if someone is under direction that they follow the same procedure. So we brought it to the board to see if there was a reason it was not included. I mean, professionally, we weren't sure, but if not, if we could look at maybe adding it to the definition of under direction. And when we were doing the unprofessional conduct, I noticed that later there is one that says failing to notify clients that your supervisee is practicing under supervision, and some people have added direction. So that would be a point we would ask that direction be added to all. And if we could put that in the definition that says something like that, making sure they notify their clients.
So under direction is if they have some kind of discipline that they're from a violation that's been determined by the CRC?
No, I apologize. Under direction, like practicing, if they're master's level, but they are not working toward their clinical license, they're required to practice under direction.
Okay.
Which is found in the definition regulation for everyone except behavior analysts. So it would just be their normal practice,
Okay.
diagnosing and treating.
Did you say in there's definition of under direction, but it does not have specificity in it in terms of frequency, contact, those kind of
Correct.
things?
Yes.
Cause this is one of those areas that does come up every once in a while.
Uh-huh. Yes.
Mhm.
And I don't know, I mean, it may be a bigger issue if it's too simple or, not spelled out enough. That may be something the board wants to look at, but we really just wanted to make sure we were kind of on the right track, that this is something, because if they're seeing clients and they have a problem with what they're doing, they should have someone they could contact.
Yes.
Leslie, I appreciate you bringing this up because I know I am starting to see this a lot more frequently in the field where individuals have completed their 2 years of supervision and are not taking the test right away, or maybe don't have plans to take the test, or they have taken it and not passed, and so there's a longer delay. And so on what you're saying in terms of making sure that clients know that they are under the direction, I think is important, but also I think a lot of supervisors, employee supervisors, not clinical
Clinical.
supervisors per se, don't really know what their obligations are as being the supervisor of someone that is under direction.
Yeah.
Well, I think there are also people that have gotten their masters and don't even have a plan to get their clinical license, but are working under direction as a master's level
Yes,
clinician.
that's really the group we're looking at.
And I do think that clients should be notified of that. I mean, for supervisees, that's in their initial paperwork with a new client. There's a form that states that they're working under supervision and gives the name and contact info for the supervisor so that they have that, but they don't have to be repeatedly notified of that. But they do have to have a very clear indication that this person is working under supervision, or in this case, it would be under direction. It seems that should be a similar practice.
On renewals of a master's level, do they have to put who is providing their direction?
Yes, they do.
Okay, that's what I thought I remembered. From what I know, and because this has come up a number of times, I would feel more comfortable that we maybe make it a bigger discussion around what does it mean, to the point that Andrea made, as a supervisor who's providing direction, what's my legal liability for being under direction versus directly supervising? I think there's a lot of both sides of this, or maybe three sides of this equation too, for the client facing part of, yes, there's a disclosure, because many clients would just assume that there's an independently licensed provider. So I think we should spend some time on this, actually. I don't know if that's an appropriate topic for the retreat board meeting, but something that we could have some bigger discussion on. There's a lot of issues around it.
We get a lot of questions about it.
Yeah.
And there's not a lot of guidance, so.
Everybody comfortable with Mary's suggestion that we spend some more time kind of doing a deeper dive on this topic? All right.
Thank you.
How are we doing on time, Dave? Is this a topic we want to take up, or?
I think we have about 20 minutes, so
Okay.
we should be good.
Next is a discussion on alternate pathways to licensure.
Yeah, and this was a topic that the board chair brought up a couple meetings ago, and had been referred to the advisory committees to have a discussion with the members of the advisory committees and the board members that serve on those committees as well, to assist the different committees. I've tried to pull information on each of the professions and have been successful in some of them, and other ones I'm still gathering information, but looking to see, are there other states that have paths that may not require licensure, or when you're looking between states, which ones mandate taking a license examination. And for Kansas, we are a little unique in that we have tiered licensure as permanent licensure, where some other states may have a conditional or a temporary or a provisional, they might call it, and you can only stay at that for a certain number of years, and then they have one level of permanent licensure. So there are some differences. But there's also a couple of our professions where there is one score on the exam to get one level of licensure, but if you get the higher score, you would be eligible for both levels of licensure. And if you take it once and get that score, you only take it once. I think that's true for the marriage and family therapy profession, and also for master's level psychology. You need a 400 for the master's level psychology license, and then a 500 for the clinical psychotherapist level. But then there are some complicating factors. For example, the behavior analysts, they have certain requirements from their the BSRB association. There's also some issues involved with the multi-state license compacts that have to do with, is there a testing requirement as part of those compacts? And so it's a topic that other states have definitely discussed. And I think different advisory committees are at different points in that discussion. So maybe with that framing, I might just turn it over back to the board members that are chairs of those advisory committees to share if their advisory committees have had a chance to discuss this yet, if you're still waiting on some information from me, or if you have had some basic comments from your advisory committees.
Social work didn't, we had to delay that to our next meeting. We ran out of time at our last advisory committee meeting, so we haven't had a chance to discuss it yet.
Similarly, licensed psychology hasn't had a discussion on this. However, when it comes to and David Fye and I have had this discussion, we have not found a case where a state allows for anything other than the EAAA. So you have to take the EAAA and you have to pass it, and it's almost, I think, universally at the 500 level in order to be a licensed psychologist, and there's no other way to become a licensed psychologist in those states. Am I recollecting that correctly, Dave, in our discussion?
Yes. For licensed psychology, the PhD level psychology, I believe I was able to pull that information, and I think there were 3 states that maybe didn't report to the group that had all the information, but for all the rest of them that had reported, all of them required passage of the EAAA at the 500 level.
Yeah,
I think,
marriage and family. Oh, go ahead.
sorry, several years ago, actually, we had an entity other than the BACB come and present, and there was quite the opposition at that time. I don't know, things may have changed. I anticipate it's going to be that there's going to be people that are very opinionated about that on the behavior analyst subcommittee, advisory committee. But we have not had a chance to talk yet.
The Marriage and Family Therapy Committee has had preliminary conversations, nothing really deep. It does seem like there's some open interest into figuring out if there's an opportunity for those who just maybe can't pass the exam, but have good clinical skills. And so we'll continue that conversation at our next meeting. And I think there was some question around other data, trying to figure out what other states, and perhaps we'll have an opportunity at this meeting coming up next week to talk about what their regulators are finding out too. So we'll be happy to bring some of that information back.
And the Addiction Counseling Advisory Committee has discussed this in a preliminary way, but states are so divided on how addiction counseling is licensed, credentialed. There, you can get a certificate in some states. Kansas currently requires a bachelor's degree, other states don't. So there's just a lot of a varied input as well as like lived experience. So we have not come to a consensus about this at all.
I'm sorry,
Well-
it took me a minute to mute my phone. Sorry. Professional counselors met, spoke about this at our advisory committee, and we could find no other states where you did not have to take the exam to pass. It seems that we plan to discuss it at the next meeting, but the general consensus was no alternate path really exists. We weren't interested in one.
LMLPs, LCPs discussed this, talked about a couple of maybe alternatives, but there was some concern about moving in that direction and how that might kind of delegitimize the profession. So we've asked David Fye to get some additional information from other states that also licensed master's level psychologists, and we'll discuss it again at our next meeting.
I'd like to add one more thing with respect to psychologists. Texas and New York are a couple of states that are determining whether or not they want to move away from the EPPP to their own licensing exam. And that is something that will be ongoing over the course of at least, I would estimate, the next year, if not longer, given the changes that are potentially or that could potentially be proposed to the EPPP. So that is something that that we will keep our eye on as to whether or not Texas, especially Texas, if they move in the direction of not having the EPPP be the test that folks need to take in order to become a licensed psychologist.
Anybody else have any comments they'd like to share? So I guess we'll keep this on our agenda and. All right, so we have an upcoming board meeting on September 29th, our out-of-town retreat. Questions about whether people want to meet for dinner Sunday night. Those who are coming in. I think there's a group of us who are planning to be there, and we've done that in the past. Shall I have them let you know?
Yeah, that'll be fine. If you're interested in doing that, you can send me a message and we'll try to coordinate something. Just as a reminder, though, if we do have a majority of board members, which would be 7 or more, we'll have to make sure that there's an agreement that you can't really discuss any board business. You can still be together, you can still eat dinner together. You just can't talk about board business, otherwise it could be seen as a meeting, and you wouldn't want to do that because then there would need to be notice for the meeting and everything like that. You could get together and have dinner, but if you are interested in doing that, just let me know, and then I'll gather those people together, and we'll coordinate something for dinner in Manhattan the evening before.
And that meeting starts at 9 a.m., is that correct?
On Monday, yes.
Yes.
Yeah, it should go from 9 until about 4. I think we have the room until 5, but that to allow some cleanup at the end.
All right, and then our next regularly scheduled board meeting is November 10th at 10 o'clock. Okay. Anything else anybody has for the good of the cause? If not, I would accept a motion to adjourn.
So moved.
Second.
All right, all in favor, say aye.
Aye.
Have a wonderful week, all.
Thanks, everyone.
Bye.
Aye.
Aye.
It's a full agenda.
It was.
Yeah.